Hi everybody, happy Monday. Dr. Stephanie Stroud here with Cornerstone's Pet Tip of the Week. So February is right around the corner. I can't believe January is already gone. I don't know where it went. I'm sure you guys feel the same way. But I guess if it's February, that means it's 1 month closer to summertime, and I'm definitely ready for the warmer weather. So I'll take it. Anyway, February is National Pet Awareness What Month? Do you know? Were you able to guess? If you guessed, or what you guessed, post it in the comment below, because I want to know if you figured it out. So I'll just go ahead and tell you, but February is National Pet Awareness for Dental Health. Okay, so what do we mean when we say dental health? Dental health means anything in the mouth, okay? That may be the inside of the lips, the cheeks, the gums, the teeth, the tongue, underneath the tongue, the tonsils. That is all related to dental health. Okay, oral health is another word for that. And I know we've done one video on this before, but with it being National Pet Health Dental Month being February, I just wanted to touch base on it again because it is one of the top diseases I see as a veterinarian. So top two diseases we see in veterinary medicine currently in our dogs and cats is one is obesity, the other one is periodontal disease. Periodontal disease is basically a term used to describe the teeth, the gums, and the bone that surrounds the teeth that holds it into the gums, okay? And so we want to make sure that we have good periodontal health for our pets. Okay, it's the number one disease I see. Now that being said, there is a variance of stages that we see. You know, we stage it on, we grade it from something very mild, which would be a 1, where I'm seeing a little bit of gingivitis, to a stage or grade 4, where I'm touching those gums, they're bleeding, and teeth are just rotting and falling out. Our goal as veterinarians is to never ever get to stage 4. In fact, we never even want to get to stage 3, because stage 3 is when we get irreversible damage. That's right. That means we've lost bone around the tooth, and that is a stage we never want to get to. Ideally, in a perfect world, I would never see any periodontal disease at all, but we have to live in reality. So reality is that I want to see patients that have stage 2 or less, because that is the amount of disease that I can reverse. Now, if we get to stage 3 and 4, that doesn't mean there's nothing I can do. I can definitely address the underlying problem there is, and then we can kind of do as much as we can to save those other teeth and keep them at a stage 1 or 2. But ideally, we always want to identify and be able to reverse periodontal disease when it's at a stage 2 or less, because that is the point where I can actually reverse things. So what are things that you should be looking that could be signs that your pet has periodontal disease? Well, the first one is, do you see brown stuff on the teeth? Okay, or yellow or white thick stuff on the teeth. Okay, that's something called dental tartar, and it's hard and calcified. Okay, that is basically what happens when you have plaque that builds up over time and becomes hardened. Okay, that becomes dental tartar. And that's stuff that can't come off with just normal toothbrushing. Okay, so pets' teeth are designed to be white, just like yours and mine. The reason yours and my teeth stay white is because we brush them every single day. Most of us brush our teeth twice a day, some of us 3 times a day if we have medical reasons to. The other reason that our teeth stay white, besides brushing, is that we go to a dental hygienist or a dentist every 6 to 12 months for a professional cleaning, okay? So that's why our teeth are white. Guess what? Our pets are no different. So their teeth are designed to be white to stay healthy. They're not meant to have red gums, which could be a sign of gingivitis and inflammation and pain, but they're meant to stay white and just nice, healthy pink gums. The gum color should be the same right by the tooth line as it is the rest of the mouth, okay? So we shouldn't have any really dark red or dark purple line right by the teeth, because that's a sign that there's disease present, okay? So how do we prevent periodontal disease in our pets? The first thing you need to know is that you should be having your pet's teeth evaluated by a veterinarian every 6 months to identify and to reduce the risk, and to take steps to measure or take measurements to decrease progression of periodontal disease. So every 6 months, your teeth, you should have an oral exam, and your pet's teeth should be evaluated by your veterinarian, okay? Number 2, if there is periodontal disease present, your pet may need to undergo a short anesthetic event in order to have their teeth professionally cleaned. I always get asked, why can't you just do pet's teeth awake? Why do you have to put them under an anesthetic? The reason being is that we use the same sharp, loud drills and tools in your pet's mouth that they use in ours. Now, some of us get freaked out by the dentist because of that, okay? And we understand what's going on. But our pets, they don't understand what's going on. And first of all, I don't want to traumatize your pet, and neither does your veterinarian. None of us veterinarians want to traumatize pets, okay, with the loud drilling sound and us being forced to hold them down when they don't want to open their mouth. Okay, and the second reason is we don't want to hurt your pets. Okay, we don't want to cause any physical damage by misdirecting, or if your pet moves or anything. Those sharp tools can cut your pet's gums and your lips, and we don't want to do that. We want to do pain-free dentistry. Okay, the best time, like I said, some people, and I understandable, it's an anesthetic. Some people will worry about putting their pet under an anesthetic. By making sure that we reach the goals that I had, that we talked about the beginning of this video, by keeping periodontal disease to a grade 2 or less, which is reversible, remember, then the anesthetic events end up being very short. So by simply having a short anesthetic event every 6 months or once a year, depending on what your pet specifically needs as deemed by your veterinarian, you can actually keep your pet safer. Okay, because if you don't do those anesthetic events, what will happen is it will eventually progress to stage 3 or stage 4 that we talked about, where your pet actually has rotten teeth, and that one puts them through unnecessary pain, because that could have been prevented with proper dental cleanings, professional dental cleanings under anesthesia. And 2, when you actually do go to do something about that, because you will need to do something about it when your pet's in pain and when they have teeth rotting out of their mouth, you end up with a longer anesthetic event. And the longer they're under anesthesia, the more risky it is. And so it's better to do multiple short events over the course of their lifetime rather than 3 or 4 really long anesthetic events. So first tip is make sure to identify what is periodontal disease. Second thing, make sure that you are taking the steps that your veterinarian has recommended for you to keep that periodontal disease managed and prevented from going to stage 3 or 4. The third step I have is, I just want to tell you, is I always ask, what's the best way to prevent periodontal disease? Well, the answer is really simple, okay? You and I brush our teeth every single day. The same is true for our pets. The best way to prevent periodontal disease is to brush their teeth. And there's a number of ways that can be done. I can certainly do another video on that if you guys would like that. But there's all kinds of resources online that you can look at for brushing your pet's teeth. Now, that being said, I did say it's the easiest thing. The answer is easy. The actual doing an execution of it is not always easy. So there are some pets that will not allow it. And if that's the case, then there are some alternatives that are not as good as brushing the teeth, but they do help, paired along with the professional dental cleanings every 6 to 12 months that we talked about previously. So if you'd like to know more about those specific things, speak with your veterinarian, or you can go back to the previous videos that I've done in the past. I went over the different products that we here at Cornerstone Animal Hospital recommend, and you can find those either here on our Facebook page, you can find them on our YouTube channel, Cornerstone Animal Hospital, or you can find them on our website, www.cornerstonevet.info. Go to the About section, and then go down to videos and pet tips, and we'll have all the videos that we've done. And there are actually 2 videos talking about periodontal disease and dentistry that I've done previously. But again, like I said, I just wanted to touch base and talk about it because it is Pet Health Dentistry Awareness Month coming up next month, and it's such an important thing that we see. It's one of the top 2 diseases that we see in our pets. So don't let your pet be in the statistics, okay? Be in the statistics that are good, meaning that your pet's teeth are taken care of, they're infection-free, and they're pain-free, because pets deserve to be pain-free. All right, if you guys have any questions or you have any comments, be sure to drop them below. Say hello. Thank you so much for watching, and I will see you guys next week. See you later. Bye-bye.